Welcome, viewers, to our newest video, in which we discuss the liver, one of the most important yet frequently disregarded parts of our health. Today, we're concentrating on fatty liver disease, a disorder that's getting more and more common in our culture. If ignored, it poses a silent threat that could severely harm our well-being. But don't worry, we're going to provide you the knowledge in this video to identify the fatty liver disease warning signs and symptoms, which you simply cannot afford to ignore. Sign 1: Persistent fatigue. Let's start with a symptom that most of us can identify with: chronic weariness. Everyone experiences occasional days of exhaustion, but when fatigue persists over an extended period of time, it may indicate a more serious issue. You see, your liver performs an incredible amount of multitasking for your body, handling numerous essential tasks like energy metabolism. It's as though someone has thrown a wrench into this well-oiled system when fatty liver disease takes hold. The liver's capacity to effectively process nutrients and generate energy is weakened as fat builds up in the organ. What was the outcome? It leaves you feeling exhausted all the time, regardless of how much sleep you receive. So, it may be time to pay attention to what your body is telling you if you are having trouble gathering the energy to do even the most basic of chores. Your liver may be alerting you to the need for action before things become worse if you are experiencing chronic weariness. We'll discuss another glaring indication that your liver may be in need of assistance in a moment. Keep checking back. Sign 2: Abdominal pain. Let us now discuss abdominal pain, more especially discomfort located in the upper right quadrant of the abdomen. A slight ache here and there might not be cause for concern, but persistent or severe discomfort in this region could be a sign that your liver is being stressed. Why does pain in the abdomen result from fatty liver disease? Your liver may enlarge and become inflamed as a result of fat infiltration. Your liver is located in the upper right portion of your belly, and this inflammation may cause pain or tenderness there. Imagine your liver as an engine that is overheating. When it is inflamed, it is signaling trouble, and one way your body lets you know that something isn't quite right underneath is through stomach pain. Therefore, you should not dismiss chronic pain or discomfort in your upper abdomen as indigestion. Pay attention to what your body is telling you, and if you want to learn more, think about contacting your doctor. Next, we'll look at another important indicator that may point to potential liver problems. Keep checking back. Sign 3: Sudden weight loss or gain. Have you observed any abrupt, inexplicable shifts in the scale? Abrupt changes in weight, whether you gain weight suddenly or lose it without trying, may be a subtle indicator that your liver is not functioning properly. You see, hormones related to metabolism and fat storage are crucially regulated by your liver. These hormones can become imbalanced when fatty liver disease manifests, which might cause unanticipated changes in weight. On the one hand, fat accumulation in the liver can interfere with hormone communication pathways, which might hinder your body's ability to burn calories effectively and cause weight gain that isn't fully understood. Sign 4: Jaundice. Imagine waking up one morning to discover that the whites of your eyes and skin have turned yellow. To put it mildly, it's a stunning sight that shouldn't be disregarded. This condition is called jaundice, and it's frequently an indicator that something is wrong with your liver. You see, among the various functions of the liver is the removal of waste materials from the blood, such as bilirubin. Bilirubin can build up in your bloodstream when your liver isn't working properly, as is the case with fatty liver disease, which causes jaundice. When bilirubin accumulates to higher than normal levels, it causes yellow discoloration that affects your skin and the whites of your eyes. It's your body's way of telling you to take immediate care of your liver. Therefore, don't dismiss any jaundice-related symptoms as a harmless oddity if you observe them. Jaundice is your body's warning indication that something is wrong with your liver and that it is not doing its job well. Stay tuned, as we'll reveal another vital indicator that may point to potential liver problems shortly. You should not miss it. Sign 5: Swelling in legs and abdomen. Have you experienced unexplained abdominal or leg swelling that doesn't seem to go away, regardless of how much you elevate your feet or rest? Although there are many reasons for edema, it's important to take notice when it coexists with other symptoms because it may indicate liver problems. Fluid retention or edema is one of the problems that can arise from fatty liver disease as it advances. This fluid accumulation frequently shows up as swelling in the belly and legs, which is uncomfortable and makes mobility difficult. However, why does fatty liver illness result in edema? As a result of inflammation and fat buildup, your liver may find it difficult to operate correctly, which may raise blood vessel pressure and result in fluid seeping into surrounding tissues. Thus, you should pay attention if you experience chronic swelling in your legs or abdomen. Even though there are many potential underlying causes of edema, it's important to rule out liver-related problems, particularly if you're also exhibiting other signs of fatty liver disease. We'll talk about another red flag that might point to liver problems in a moment. Stay put. Sign 6: dark urine. Imagine this. You go to the bathroom and, as you flush, you discover that the color of your urine has significantly darkened. While nutrition and hydration levels can affect urine color, consistently dark pee may indicate that your liver is not functioning as well as it could. You see, the liver plays a vital role in the breakdown of waste products like bilirubin, which are created when your body breaks down old red blood cells. Normal bilirubin excretion from the body occurs through urine, which is why urine has that distinctive pale yellow hue. However, your liver may find it difficult to properly process bilirubin if it is weakened, as is the situation with fatty liver disease. Because of this, too much bilirubin may build up in your blood and eventually find its way into your urine, giving it a deeper amber tint. Therefore, it's important to pay attention if you frequently notice that your pee is darker than usual. Although it's not always a reason for concern, black urine can be a subtle indicator that your liver may require additional care. Stay tuned, as we'll reveal another vital indicator that may point to potential liver problems shortly. You should not miss it. Sign 7: loss of appetite. Have you ever realized you're not hungry while you're staring at a dish of your favorite food? Periodic loss of appetite may indicate a serious problem with your liver, even though it's common to have swings in appetite. Your liver is an essential component of digestion because it produces bile, which aids in the breakdown of fats and the absorption of nutrients from food. However, this delicate equilibrium may be upset if fatty liver disease becomes prevalent. Inflammation can develop in the liver as fat builds up, impairing its capacity to create bile and control digestion. What was the outcome? After just a few bites, you can find that you're full, or worse, that you have no appetite at all. Thus, it may indicate that your liver needs some care if eating has turned into a work rather than a joy and your favorite foods have lost their attraction. Rest assured, we're not quite done yet. Stay tuned as we reveal further indicators of fatty liver disease that you should be mindful of. Sign 8: weakness and confusion. As we delve more into the world of fatty liver disease, we come across symptoms that are not limited to the body. Weakness and disorientation are two such symptoms that can completely disorient you and leave you in a fog of doubt. You see, there is a greater connection between the liver and the brain than you may think. When toxic compounds are overloaded onto the liver, it becomes less effective at detoxifying them. Furthermore, poisons can have a disastrous effect on brain function when they build up in the circulation. What was the outcome? Feelings that can sap your energy and cause you to feel weak, lethargic, and confused. A malfunctioning liver may be indicated if you are having trouble focusing, forgetting things, or feeling disoriented for no apparent reason. Take heed of these warning indications. Make contact with your healthcare practitioner so you can receive the assistance you require to take back control of your health and well-being. As we come to the end of our examination of the symptoms and indicators of fatty liver disease, keep in mind that information is power. You can protect your liver health and live life to the fullest by educating yourself and taking preventive measures. Till then, be careful and continue to be well. Sign 9: spider veins. Let's now highlight a visual clue that may draw your eye. Spider veins. Sometimes these tiny, spiderweb-like patterns on the skin surface are more than just an aesthetic issue. You see, the proper circulation of blood throughout your body is dependent on the liver. Increased blood vessel pressure might result from the disruption of this delicate equilibrium caused by fatty liver disease. Consequently, little blood vessels called capillaries that are close to the skin surface may widen and become visible, resulting in the formation of those recognizable spider veins. Spider veins can be a visible symptom of underlying liver problems, even though they may not be a serious health danger in and of themselves. Therefore, it's worth seeing your healthcare practitioner for a closer examination if you observe a lot of spider veins appearing, especially if they do so in addition to other symptoms we've covered. Stay tuned as we conclude our examination of the most prominent indications and manifestations of fatty liver disease. You won't want to miss our concluding remarks and most important insights. Sign 10: Elevated liver enzymes. One signal that is particularly useful for diagnosis when examining the warning signs of fatty liver disease is increased liver enzymes. Numerous enzymes that are produced by your liver are essential for metabolism and detoxification. These enzymes can seep into the circulation when the liver is stressed or injured, acting as warning signs for possible liver problems. Healthcare professionals frequently look for high levels of enzymes like aspartate aminotransferase, AST, and alanine aminotransferase, ALT, during standard blood testing. Increases in these enzymes may be a sign of injury or inflammation to the liver, especially fatty liver disease. Consider it your body's warning system telling you that something might not be right with your liver, the main organ of your body. It's important to keep in mind that fatty liver disease isn't necessarily indicated by high liver enzymes. Other variables such as alcohol intake, certain drugs, or viral hepatitis can also cause them to be increased. But when they're paired with other symptoms we've covered, more research is necessary. Thus, in the event that your blood tests show high liver enzymes, don't be alarmed, but also don't disregard them. Speak with your doctor to find the root cause and take preventative measures to protect the health of your liver. And there you have it, people, a thorough explanation of the indicators and manifestations of fatty liver disease. We've discussed a wide range of topics, from dark urine to chronic exhaustion, emphasizing the value of listening to our body's signals. Recall that your liver is a powerful organ that is essential to maintaining your overall health and well-being. It is not just another organ. The good news is that raising awareness of the symptoms of liver malfunction is the first step towards prevention, although ignoring them can have grave repercussions. Thus, there are several actions you can take to maintain liver health and prevent fatty liver disease, such as eating a healthy diet, exercising more, or consuming less alcohol. We appreciate you coming along on this journey with us to learn more about our bodies and give liver health a priority. Recall that your liver is deserving of love as well. So let's agree to pay attention to its murmurs before they become cries. Till we meet again, be careful, maintain your health, and never undervalue the influence of a healthy liver.